the sebum? Sebum levels are higher in postmenopausal women receiving hormone replacement therapy, which helps maintain skin moisture. Postmenopausal women aging, menopause affects the sebum production, but hormone replacement does not significantly control the complex process of seborrhea. HRT does mitigate the progression and enlargement of the openings of the sebum follicular reservoir. So if you go over to Sephora here in the hotel, they have all these little things there for the size of the pores. Oh, the size of the pores get large. Why? It's because of the lack of estrogen related to what happens to the sebum content. And of course, you knew I would get to wrinkling at some point. It is synonymous with aging. It's also affected by the environmental and hormonal factors. It occurs to decrease skin elasticity as a result of elastic degradation and loss of the connective tissue. So in one trial, postmenopausal women monitored for 5 years, skin elasticity was shown to decrease by 1.5%, a change that was not seen in women that were on hormone replacement. There's another trial listed here too, same thing, skin elasticity, wrinkle depth, all had to do with what happened with estrogen. In a very large cohort study, wrinkling was reduced in postmenopausal women that were using an estradiol patch because it positively affected collagen type 3 and hyaluronic acid. How about phytoaging? When photoaging, when you look at UVB exposure, it's associated with the upregulation of MMP production, leads to an increase in collagen breakdown, thought to decrease types 1 and 3. Estrogen, again, helps resolve that. And certainly the vascularization, the smoothness and softness of the skin, all of those have to do with estrogen. It does enhance the level of vascularization in the body and consequently retards the skin aging process. And then of course studies on wound healing. Wound healing, estrogen reduces the wound size and stimulates matrix deposition in both human and non-human trials. Estradiol applied to the skin in these studies improved wound healing in animal trials because it decreased the inflammatory component in the body. So as you have seen, I hope I have convinced you so far, that one of the reasons that we look at hormone replacement has to do with how the skin is going to look. Is it the only reason? Of course not. Hormones really do affect cardiovascular health. They really do affect brain function and a myriad of other things. So estrogen increases epidermal hydration, skin elasticity, and all the other things that we looked at so far, and improves wound healing. In this study, it increased epidermal hydration, skin elasticity, and skin thickness. So these are some great articles if you're going to pull up a couple to read on what happens with estrogen. So it affects the epidermis, the dermis, the vasculature. It affects the hair follicles, sebaceous, eccrine, and apocrine glands, skin aging, pigmentation, hair growth, sebum production, and whether the patient has an increased risk, and even skin cancer. The extracellular matrix responsible for the tone and appearance of the skin is improved by estrogen, and it also benefits the cutaneous injury repair. It increases mitotic activity in the epidermis of the skin, which correlates with thickening, and we could go on and on. It helps with the receptor sites, many locations in the body on the skin. So yes, the cellulite that people get under their arms, all of that is affected by estrogen. Positive effect on the sebaceous glands and the apocrine glands as well. In this study, it examined the look of estriol on the abdominal skin in 13 postmenopausal women for 3 weeks, and it only took 3 weeks. The elastic fibers in the papillary dermis were thickened, better oriented, and slight increase in number in a half of the patients, but not in the control group. So estriol in the skin has a positive effect. In this study as well, microscopic improvement in the elastic and collagen fibers. And here the study examined the use of estradiol and estriol compounded. And after 6 months, the elasticity and firmness of the skin improved. The wrinkle depth, pore sizes all decreased. Did they decrease slightly? No. What happened is the wrinkle depth decreased by 61% and the pore size improved by 100%. Studies showed that estrogen can help to prevent some extent of really the negative aspects of connective tissue turnover as well. So we could go on and on. Another great study, after menopause, skin elasticity declines in this study by 0.55% per year. 12 months of, in this case, they did synthetic hormone replacement, it increased elasticity by 5.2%. We all know better than to do